It is important to understand that the heart is not just any organ, it is one of the most vital organs for sustaining life. The heart is a muscular, hollow organ whose main function is to pump blood, and it's what? This blood carries oxygen and nutrients that body cells need to survive, and it also helps remove waste products such as carbon dioxide. The wall of the heart is mainly made of a special type of muscle called cardiac muscle. This muscle is different from other muscles in the body because it contracts automatically without conscious control. That means you do not have to think before your heart beats. From before birth until the end of life, the heart keeps beating continuously. This continuous beating is what keeps blood moving through the blood vessels to supply all organs, including the brain, kidneys, and lungs. In an adult at rest, the heart usually beats between 60 and 100 times per minute, although this can vary depending on age, physical activity, illness, or emotional state. Each time the heart beats, it pushes blood into the blood vessels, ensuring that tissues receive enough oxygen and nutrients to function properly. Ensures that the heart stops beating or does not work well, body tissues quickly begin to suffer damage. Nurses and allied health professionals, understanding the heart is extremely important because many patients suffer from heart-related problems. Conditions such as hypertension, heart failure, and abnormal heart rhythms are commonly seen in hospitals, and symptoms such as chest pain, shortness of breath, fast heartbeat, or low blood pressure may indicate problems with the heart. Because of this, a good understanding of how the heart works helps in detecting problems early and providing safe and effective care. Before we move on to the next one in our outline, don't forget to like, share, and subscribe for more videos.